When it comes to health care, as it will for all of us in this country, America, we have what is called the Affordable Care Act, the ACA. Some people call it Obamacare, dumping it off on its main proponent. Opponents of this say that it is not affordable and that it provides no real care. Supporters of this are people who now have health insurance, many for the first time. For them, it's a godsend. They don't have to pay for it, and they say the care is wonderful. I can see why they would feel that way. Before it became a law, it was a bill, and on paper it was over 2,000 pages long. Clearly, few people had read it, and there was a suspicion that no one had read it, not in its immense entirety. In a famous exchange, a member of Congress who supported the bill was asked if she had read it. "No," she said, "I haven't had the time." "Well," she was asked, "if you haven't read it, how can you understand it?" "We'll understand it after we pass it and it becomes a law," she said. I record that because, as the saying goes, you can't make shit like that up. And they did pass it, all 2,000 plus pages of it, whatever it said, and it became a law. 2,000 pages. The Declaration of Independence is what, 2 pages? There were some glitches in what was called the rollout when people tried to sign up for it on the internet. And in another outstanding example of you can't make this shit up, an email came out or a recorded message, something, from one of the principal architects of the law, saying that he was never worried about the passage or enactment of the law because the American people were so stupid. That's all the more amazing because he was right, and his analysis proved to be correct. A few people objected to being characterized as stupid, and they tried to make something out of this, whip up some outrage, but not much came of it, again, because he was correct, we are stupid. Must be nice to know there are some things you can count on. So, now that considerable dust has settled, how is the ACA working? Who knows? I certainly have no idea. I think some states are trying to override it or fight it in the courts. I'm guessing that some people, the benefactors who can now afford health care because they don't have to pay for it, love it, while others who feel they're paying an unfair share of the cost do not. What do I think? Here's what I think in the good old proverbial nutshell. The more you need help in this system, the less likely you are to get it. That bears repeating. The more you need help, the less likely you are to get it. Let's call it catch-23. What does that mean? It means that as long as you are healthy and paying into the system, which by law you must do, it's mandatory, everything is fine. But when you get sick and are in need of care, they will drop you from their coverage because it would be bad business policy to keep someone like you on their rolls. And they are businessmen, not the little sisters of the poor. You would be much better off if you took your money and invested it in an account, and then when you got sick, you could use the money you've built up to pay for your care, or at least some of it, because that care is going to be insanely expensive. It's calculated to suck out every last cent from you before you die. And you die because after they get that last cent, they're no longer interested in you, you're a liability, and they show you to the door. But you can't save up for health care. You have to pay into the system. That's the law. It's like any other tax. It's the newest avatar of Social Security. One more way for the government to get into the wallet of anyone with money. And because we're stupid, we'll obey the law and things will be fine until we get sick. Then we will pose a bad risk and we'll be out on our own. As far as I can see, which is none too far, the only ones who will do well in this system are the ones who get free health care and the insurance companies. Everyone else is going to get fucked, big time, which would be a real shame if we weren't so goddamn stupid.